and welcome to part 3 of our lecture on the skin. In part 1, we looked at the layers of the epidermis, which is up here. In part 2, we looked at skin coloration. So in this part, we're going to look at the dermis. Now, the dermis is this region of the skin right here, and it's actually divided into two parts. We have the top part of the dermis up here. I guess it would be this superficial part of the dermis. That is made up of mostly elastic and areolar connective tissues. Then the deep dermis is the reticular dermis. It is made up of dense regular connective tissue. Shaded in red is the papillary dermis. You can palpate it because the areolar connective tissue lets it fill up with fluids. And then the reticular dermis is made up of the dense irregular connective tissues. Now, the papillary dermis, that has blood vessels in it, capillaries and arterioles, that are going to supply the epidermis. Remember, epidermis is epithelial tissue. Epithelial tissue lacks blood, so we need a blood supply. This blood vessel is going up and down, so I drew this wavily for that reason, that you have these dermal papilla that are increasing the surface area, and I'll mention those in lab. Now, you also have touch receptors called Meissner's corpuscles, and they're stuck in here too, and they look like little Vienna sausages. So, they're stuck into these dermal papilla. So this right here would be a dermal papilla. And that's the papillary dermis. It's not very exciting. It has these blood vessels that are supplying the epidermis. It has the Meissner's corpuscles, which are a light touch, and it has the dermal papilla, which increases surface area for these blood vessels. So that means all the fun stuff is actually down here in the reticular dermis. The dermis is deep to the epidermis. So this is the epidermis up here. You can see the very nice clear stratum granulosum and corneum. That means what's below it down here is the dermis. You can see we have two layers of the dermis. This layer right here, the connective tissue is different from this layer down here. So the papillary dermis would be in this area. We have our dermal papilla. See how it goes up and down. The up part is the papilla. And then the reticular dermis is deeper. Now, the papillary layer of the dermis is adjacent to the stratum basale. So this down here is the papillary layer, and this is the stratum basale. It's mainly areolar and elastic connective tissues, so we could see some of the elastic fibers there. And there are these dermal papilla, singular papillae. And the papilla are going to increase the surface area. In physiology, you're going to learn increased surface area, better for diffusion. Now, this part right here is an epidermal ridge. They interlock with each other. I only have dermal papilla on the test, so these are the dermal papilla. Now, inside the dermal papilla are these corpuscles that look like Vienna sausages called Meissner's corpuscles. Those differ from the tactile cells that are in the epidermis. Everybody's favorite corpuscle, the Meissner's corpuscle. They hate spelling it, that's why I say it's their favorite. It's in the papilla, so this is the dermal papillae, and you could see the Meissner's corpuscle in here. So here is the Meissner's corpuscle. They look like Vienna sausages. They actually look like the grubs I find in my lawn when I dig it up. That's gross, isn't it? And they're sensitive to a light touch as well. It's a different frequency of touch than the itsy bitsy spider. It is the green tree snake that decided to climb into your sleeping bag with you in the middle of the night. So, it's sensitive to a light touch. It's a little bit harder than the tactile ones, and in physiology, you're going to learn phasic versus tonic receptors. One of them's tonic, one of them's phasic. We're not going to worry about that right now, though. So, you have these Meissner's corpuscles. They also give you a light touch. It's different from the tactile cells. The papillary dermis up here is extremely boring. So this is the papillary dermis. It's not that exciting. It has Meissner corpuscles. Look, there's the blood vessels going into the papilla. That's it. Now we have this humongous reticular dermis. Look, a sweat gland. Oh, look, a nerve. Ooh, an oil gland. If I move down, another type of corpuscle. We have all the fun stuff in the reticular dermis. It is made up mainly of dense, irregular connective tissue. Guaranteed that's going to be on the test. It has our hair follicles. It has our lamellated or piscine corpuscles. I like piscine better than lamellated because I have seen 20 spellings of laminated. It's driving me crazy. Or piscine, there's only one way to spell his name. So this is the piscine corpuscle, and that's right at the hypodermis down here. So, I want to first talk about lines of cleavage. That are bundles of collagen fibers that are oriented in one direction or another. So it's the orientation of collagen fibers. You might have seen them as stretch marks. I'm not going to show you my stretch marks. I've gained about 50 pounds sitting in isolation the last 3 months. So it happens when stretch marks happen when these lines of cleavage get broken and reformed. Now it's important for surgical procedures. Now, growing up in the 80s, sometimes you'd see somebody that had a scar going like that. See how that's moving against the line of cleavage? Well, when they took out the appendix before, it was an emergency, so they would cut a vertical scar because it was easier. Now, with laparoscopy, instead of this vertical one, they do a little cut like that, smaller, and it doesn't scar. So the lines of cleavage are important to know for surgical procedures. If you cut along the lines of cleavage, like this, you won't get a scar. I know somebody that has a nice scar going down like that. Well, what organ's right behind the sternum? Yeah, that's the heart. They wanted to get in there. For some knee surgeries, again, they used to cut like this to get in there. Now, with endoscopic medicine, they're able to cut like that and not leave a scar. So lines of cleavage are important just so you don't leave scars in these collagen bundles. So here's our skin picture again. And right here at the deep dermis, you're going to see these onion-like things. And these are called lamellated or laminated corpuscles. And they get that name because you're adding layer upon layer upon layer. Now, because I've seen so many spellings of laminated, laminar, laminaire, I like calling them by piscine corpuscles. He gets to keep his corpuscle since Meissner got to keep his. Piscine corpuscles, those are sensitive to a deep touch. That is, somebody bumps into you on a crowded subway car. That is, your 20-pound cat just decided it wanted to sit on you. Now, these are fast adapting. So that 20-pound cat, it jumps on you. You stop noticing it's there after a little while because they adapt. And there's a neat trick in physiology. What you do is you put a penny on your arm and you get distracted. The penny's weight goes away in a few minutes. Then you put another one on. And I think the record in my class was 5 pennies before they actually started to notice it. So these piscine corpuscles are a heavy touch. The Meissner's corpuscles and the tactile cells are light touch. So these lamellated or piscinian corpuscles are described as onion-like because you have these layerings of it. And they're usually found at the hypodermis, so here's the adipose cells. And they detect large pressure changes. You actually have these in other internal organs detecting pressure changes. And this is going to give you a crude touch. They adapt quickly, which means it goes away. And allegedly, they are spaced out a lot in the skin. When we actually look at the palm skin slide in class, you actually have a lot of them. So that's sort of wrong in the textbook, but if you look at any other skin slide, it's going to be hard to find them. Now, the hypodermis, that is subcutaneous fat. It's not part of the integument. It is underlying it, connecting it to the muscle underneath. It's areolar and adipose tissue. Remember, areolar is all over the place. If you had to guess a connective tissue, your first guess should be areolar, your second guess dense irregular. And it protects underlying structures. It's a storage of energy and thermal insulation. So when winter comes, I'm not going to have any problems whatsoever. So, we've left off things like sweat glands and oil glands and hair. So, we're going to look at those next. So I have some questions. What is this pink layer made up of, the papillary dermis? Is it dense irregular connective tissue or areolar? Papillary dermis is made up of areolar connective tissue. Question number 2. What corpuscle do I find? Meissner's corpuscle. So, the reticular dermis down here. What is it made up of? Of dense irregular connective tissue. And what's its corpuscle? Pacinian corpuscle. Now, Meissner's, what kind of touch was that? It was light. And Pacinian is heavy. And true or false? The hypodermis, is it part of the skin? That is false. It is not part of the skin. So, thank you very much for watching. I will see you, or I guess talk to you in part 3. I mean part 4. Thank you.